We're here this morning to announce a historic and much-needed opportunity for thousands of residents in our community to receive free dental, vision, and medical care in Lake Charles on September 15th, 16th, and 16th of 2018 at the Lake Charles Civic Center. We're calling this endeavor Operation Healing and Restoration. I am so proud and so honored to be speaking these words here today. So much has happened behind the scenes to get to this announcement today. This is the first ever event of its kind in the state of Louisiana. Studies have shown time and time again that access to quality health care is essential if we truly want to get to the root cause of poverty within a community. We believe that this event will have lasting effects throughout our community. It truly is a Herculean effort to put this event on. While we may not be able to host it every year, we hope Operation Healing and Restoration may connect some of our brothers and sisters in need to health services and care that may be available to them year-round. We hope for this to be the spark of a lifestyle change for many, not just a one-day screening. This weekend would absolutely not be possible without numerous partnerships that the City of Lake Charles has forged with other government agencies, nonprofit organizations, hospitals, physicians, nurses, and volunteers in the region. I am proud to announce that solely because of these partnerships and careful coordination, we've been able to secure the commitment of Remote Area Medical Services. Remote Area Medical, or RAM for short, is the largest non-governmental provider of medical clinics delivering free, high-quality dental, vision, and medical care to underserved and underinsured individuals, children, and families. Founded in 1985, RAM originally was created to serve as a safety net provider of free medical care in remote areas of developing countries such as Guyana, Mexico, and Haiti. Almost immediately after beginning operations, the organization began receiving requests to operate medical clinics in the United States. I'd now like to direct your attention to the screens behind me for a brief video on the program that we are bringing to Lake Charles. I assure you it's worth your time, and this video will give you all a much better idea of what we are so excited about.
Millions of families are living in a crisis because they cannot access health care. Millions of people live in pain, suffering from preventable disease and hardship. Remote Area Medical, RAM, responds to their needs by providing free quality mobile clinics. In less than 12 hours, RAM turns schools, stadiums, jungles, and arenas into fully functional medical centers able to provide dental, vision, and general medical care to thousands. Families are so desperate for this care that they begin to line up 48 hours before a RAM clinic begins, often sleeping in their cars to make sure they get one of those precious numbers which will ensure them entrance. For many, a remote area medical RAM clinic can mean the difference between life and death, between securing a job and struggling to make ends meet. For some, it means providing for their family and improving their quality of life. And for every person who receives care at a RAM clinic, it means stopping the needless pain and suffering they have to deal with every day. Our mission is fueled by private donors and driven by the power of volunteers. They join forces to support people who have nowhere else to turn. We all face hard times in life, and everyone needs a helping hand at some point. RAM extends that helping hand with a mission to provide free quality health care to those in need. RAM works with local partners called community host groups. A community host group gathers resources, rallies sponsors, and recruits volunteers on the local level to ensure a successful clinic in their community. RAM works to empower and equip these local partners to fulfill their own mission and purpose. As a result, RAM and communities converge on a shared mission as we roll up our sleeves and address our problems head on. Together we can make a difference, and together we can lead hurting people to a better future. As local leaders prepare for the free RAM clinic, they work directly with experienced RAM staff to build effective strategies and address the crisis their community faces. They need to understand the scale of the clinic and what it takes to provide quality care and follow-up. The demands of the clinic include an appropriate venue to facilitate the hundreds and perhaps thousands of potential patients, water and electricity, security, logistical support for patient and volunteer flow, food and lodging, all must be organized, and RAM helps the local community host group to stay on task to achieve our shared objectives. By joining with a community host group, RAM is able to offer a turnkey, comprehensive clinic using millions of dollars worth of mobile units and equipment and a cutting-edge registration system, as well as experienced RAM personnel. RAM also shares the burden of cost with the community host group, so the expense of the clinic does not drain local resources. RAM has always worked to bridge gaps in our healthcare system. A person who needs a dentist cannot go to the emergency room to fix their teeth, and a person who needs an optometrist cannot go to a walk-in clinic to get a pair of glasses. Many families cannot afford their insurance deductible. Unfortunately, RAM may be their only source of health care. When a patient comes to a RAM clinic, they may face a long wait in line, but they receive professional medical services, and it's free. They meet doctors who want to help them. They meet people who care. When patients leave, their suffering has been eased, their hope has been restored, and their lives have been improved. They often hug volunteers, thanking them for providing what they needed but couldn't afford. Volunteers leave the clinic knowing their help was needed and appreciated, and the experience brings fulfillment and joy to their lives. Remote Area Medical is a pioneer of no-cost healthcare, and we continue to set the pace to create a better and healthier future for the underserved communities in this country. I started RAM to serve those remote areas of the world that have no access to healthcare. But then I discovered that there were millions of impoverished people right here in the United States. So we've become the champion of the sick and the poor and the underserved, in fact, the voice of millions of people who simply cannot get the care that they need. So you can become part of something that makes a real difference and help us bring free, quality health care to millions of children and their families. Please join me on this compassionate journey of hope, and I do trust that I can count on your support. Thank you very much.
None of this would be possible without financial support. I'd like to ask our generous sponsors to join me as I call your names out and stand at the front of the chamber at this time. Partnerships. Partnerships is the most important word of my administration. And whether it's this event or other initiatives throughout the city, we can do so much more when we pool our resources. And so, again, I'm so proud and so honored to have so many partners in this endeavor. Representing Calcasieu Parish Police Jury is President Judd Barris and Tarek Coley. Judd, why don't you stand next to me right here? And Tarek, if you would join us at the front of the chamber up there. Representing Calcasieu Medical Reserve Corps today is Angela Jewett. Representing West Calcam Hospital is Janie Frugier, Hospital CEO, and Kaylee Spell, Director of Marketing. Representing Christus St. Patrick and Christus Lake area is Joy Huff, Vice President of Mission Integration, and Louise McDaniel, Regional Manager of Southwest Louisiana Workplace Wellness. Representing Lake Charles Memorial Hospital is Matthew Felder, Marketing Manager, Bernita Lloyd Brown, CEO of Moss Memorial, and Jessica Duhon, Wellness Manager. And representing United Way of Southwest Louisiana is Ms. Denise Durrell, CEO. Again, these are our financial partners, and we owe all of them a debt of gratitude. Thank you.
You know, we've proven in this community that we can do this successfully during disasters. when we control nothing. So it's nice to where we're mobilizing and gearing up to do something like this when we get to control all the variables. So think of how much better, we're going to be able to do for our people, or the folks that need every bit of what we're going to be able to provide to them. The parish is proud to collaborate, partner with all of the entities, all the groups, and on behalf of the jury and our staff who worked diligently, I'm sure, to get to this end. We're proud to be here, and we want to make sure that everyone knows that we want to see this through, so anything that we can do at our level, we're here.
Thank you, Jennifer. Thank you, President Barris. I would now like to invite Emily Ashworth, the city's wellness coordinator and registered nurse, to join me at the podium. She's going to introduce a number of volunteers and doctors who already have signed up to make this event possible. Emily volunteered to work a similar operation in Houston last year, and that personal experience is what led her to want to bring this event to Lake Charles. Her passion for helping others is contagious. And her willingness to serve makes her the perfect person for this job. Emily Ashworth, everybody.
First, let me say thank you to Mayor Hunter for his vision and for his willingness to accept new ideas and to do something this monumentous for our community. Thank you. I would like to introduce our leadership team. Over communications, Mr. Jonathan Evans, that's sitting at the computer. He's actually over our print shop here. Oh, he moved behind the camera. He wears many hats in the city of Lake Charles, but we are ever so grateful for him actually taking the role of being communications and helping the community host group lead. Web and digital content, Ms. Julie Pippin.
Julie, open the door
Yes.
in front of you, call your name, please.
Julie is project specialist and works here in the mayor's office. She is going to help with web and digital content. My team support, my right hand, Alexis Reed. She actually works assistance for Mr. Lenny in emergency preparedness. Our hospitality chair, Ms. Kimberly Delafosse, which I believe that she made it. She was in a meeting. She's another one, wears many hats. She is assistant city administrator here for the city of Lake Charles. We're happy to have her on board as part of the leadership team. Mr. John O'Donnell, coalition coordinator for a partnership for healthier Southwest Louisiana. He is actually going to be lead for our recruitment team. Mr. Matt Young, who's public information officer here for the mayor's office, is going to lead our promotions team. He's actually behind the camera. Captain Nate Keller with Lake Charles Police Department is going to be manager of our event security. Jim, I always your last name. Jim Potteroff and Susie Kingley, managers of the Civic Center. That's how they said they want it said. They're actually going to be our main point of contact when it comes down to everything that takes place in the Coliseum and Exhibition Hall. Our interpretation chair, executive director of La Familia Resource Center, Mrs. Sylvia Stelly. She will lead our group of translators. And last but not least, who's already standing, Health Initiatives and Strategic Partnership and Director of Medical Reserve Corps, Ms. Angela Jewett, is actually going to lead our healthcare volunteers. Healthcare providers volunteering their time and talent are the driving force of the success of this monumentous event. I would like to take the time to invite those who have committed to volunteering for this event to come up front and stand with Mayor Hunter and our leadership team as I call your name. Dr. Daniel Weaver. He is actually owner of Center for Restorative Dentistry. He is also president-elect for the Louisiana Dental Association. Dr. Jody George, Family Care Center, Southwest Louisiana in Westlake. And he also has his student with him, his student doctor. You can come on forward because we're encouraging students to also be a part of this. This is definitely a wonderful event. And this is student Dr. Rice. from William Carey University. Ms. Lindsay Buford, psych mental health nurse practitioner with Lake Charles Memorial Hospital. Ms. Lauren Corville, family nurse practitioner with Lake Charles Memorial Hospital. Bridget Redledge Cole, registered nurse. She's also the maternal child health coordinator for Region 5. And though he is not a healthcare provider, he has a host of providers at his clinic, and they are the only community clinic here in the city of Lake Charles. I would like to invite Mr. Tommy Anderson to also come and stand, CEO of SWLA. They are also going to be a financial contributor for this event. While we are grateful and thankful for the commitment of these great providers, the amount of community members we can serve is based off the providers that volunteer. We need you. We need the nurses, the nurse practitioners, the doctors, the dentists, whatever area in healthcare that you work, we need you. Now, we can't just have them on board. We have to have people greeting. We have to have people working registrations. So if you're out there and you want to volunteer and you want to be a part of this event, please, when we get to the contact slide, make sure that you contact us. Providers outside of the Lake Charles area are also welcome, all throughout the state. It does not have to be only providers here in the city of Lake Charles. All volunteers must register at the RAM website. The video that you saw is actually on that website. So if you want to watch it again or share it with those in your organization, you can go to www.ramusa.org. And we will give you more instructions when it comes down to registration for volunteers. Jonathan, can you go to the contact slide for me, please? Sure. Mayor Hunter is going to come back.
I don't want to keep everyone standing, but we did this for a reason, to invite everybody up front. We want the community to understand that this sample is just a small speck of what is going to be needed to accomplish this goal. So without hurting everyone's knees and ankles for any longer, I just want to thank everyone again that is standing in front of this room today. Thank you.
The contact information is on the slide. Again, my name is Emily Ashworth. My office is here in City Hall on the second floor. If you need absolutely anything, please do not hesitate to reach out to me. My phone number is 337-491-1378. My email address is emily.ashworth@cityoflc.us for those who may be listening to this. Again, thank you to all our sponsors. We're definitely going to announce our next meeting for community volunteers. Our leadership is definitely going to be reaching out. For those of you who saw the leadership team that was represented here, if you want to help with them, be it hospitality, volunteer with healthcare, if you want to exchange information, please feel free to network once this meeting is adjourned. Again, do not forget, this is going to take place September 14th, 15th, and 16th. The 14th is setup day, okay? I cannot tell you enough how important it is. If you are volunteering, but you need services, please do not volunteer during clinic day. You want to volunteer during setup day. And the reason why I say that, when you dedicate yourself to volunteer for this event, if you are in need of services, you would short those who actually need our coordination of services, okay? The December 9th event that I went to, one of the things that I noticed was those who were volunteering for registration and different things like that stood up, got in line, got a ticket, and said, I want some services. So it left us short, and we had to rearrange folks. So again, we thank you for everything. Full clinic day is on the 15th, half a day on the 16th, okay? And we will definitely send out more details as the time nears. Thank you. Thank you, Mayor.
Thank you. I'll just say a couple words. In closing, I think we'll invite the media for questions after we're finished here. I want to stress that volunteers are so important for this event, specifically volunteers in the medical community. We need your help. This, honestly, is a lot more about warm bodies showing up than it is about raising dollars. We want to help people. That's our goal as elected officials. It's our goal as brothers and sisters in this community. We want to help people, and we need volunteers to do that. So we stress that point to the community. Please contact us if you have it in your heart to help with this event. Again, thank you for everyone that joined us today. Thank you all so much.